Okay, so I'm probably going to speak very, very quickly because it is 5 to 7 minutes. That might also be because I'm really tired and over-caffeinated. So if I lose you, I'm really, really sorry. I'll try and speak slowly. Okay, so I like to call it a dynamic, you see, or problems already, a dynamic electronic health record. And the reason that I like to call it dynamic is because there's plenty of what I call static. You enter information in and it does nothing. So I only believe in dynamic, and that's the one that I'm going to really, really push, because that's the one that drives change, that's the one that is beneficial to patients, and that's the one that for me is important. So in hemophilia, we were originally starting out with, we had one national centre, and then we had we had two comprehensive care centres. One was children's, one was in Cork, and then we had a number of hemophilia treatment centres. They were, sorry? Oh, sorry. So we have those key centres that patients go to. Now, there's a number of other hospitals, and I will get to that, but at the moment, this is where we started off. And we had an electronic health record that went between the two hospitals. As with most health records at the time, it just went through the couple of hospitals, didn't link into anything else, and you have no information in any of the other hospitals, as you pointed out, which is a major issue. And the really little arrows are information, which are either data in terms of Excel spreadsheets going back and forth, or databases, but I've switched it away from data to information because we had to change the piece when I get to the patient care piece. So we built on that, and that electronic healthcare system now allows us to purchase medications. It all comes into one location, and that goes into a van, and that goes to the hospitals, and it goes to the patient's home. So again, no real information coming in from the patient at this point. We're using the electronic health record to put information into the stockist, which is great and useful. We measure it going into the van, and we measure basically where it is. And I do mean basically, as in, these are the batches. There's 2,000 batches in this hospital in Cork. That's all we have, that's all we know at this point. And we took the opportunity over the years and some of the savings that we made to introduce an electronic patient record. We did that using the health record itself first. So we looked and we monitored all of the volumes that were going in. We broke out all of the volumes for the different hemophilia A, hemophilia B, von Willebrand's. We defined key tenders and where the treatment was supposed to go. So now we have the electronic health record the information going to the product selection committee, which has patients involved. It is then being used to drive the tender, as to which the patients are involved in choosing the products. It then goes into the independent delivery company, and then that's shipped. And we have information going back and forth between each one of these sections. But at this point, we still don't have any information being collected from the patients themselves. So in one of the tenders, we made a saving, and we used that saving to develop a patient app. And the patient app was not just to collect information from the patient, but to run the entire system appropriately and correctly and monitor everything. So what happened in terms of GDPR wasn't around at the time, we had information that the patient scanned their treatment on use and it went to the hospital. But the patient doesn't really care. And I am one of the patients. I don't care about, I think I'm with somebody earlier on, I don't care about how many events I've had in the last 2 or 3 months. It is important to me, it is exceptionally important to me, and it's important to my treatment, but on a day-to-day basis, it doesn't bother me. However, by introducing this, my conversation with my clinician changed, because what I was doing was I was writing down on a piece of paper in the car park, going into the hospital going, I hope you don't get caught, I hope he doesn't see it, and you just space them out because you just get tired of doing the same thing over and over again. So all of it was scanned, it was all gone into the clinician, and the conversation changed from, how many bleeds have you had in the last couple of months? I was like, 3. And he was like, oh, okay. It changed to 2, how many bleeds have you had in the last couple of months? I was like, I've had 3. And he went, no, you've had 8. They've all been on your right-hand side, so I'm changing your prescription to every second day rather than 3 times a week. And all of those bleeds have been on the right side, predominantly your right ankle. So we're using the physiotherapist to build up the strength of that right ankle, and prescribed a couple of them. So we're like, okay, now I'm actually creating information that is useful to help me get on with my daily life. Finally, super. But that's not enough, because you still want to drive some more. We used that information within the hospital system as well. So what we wanted to do was create a situation for patients to be able to go to any individual hospital in Ireland in the case of an emergency and be treated. They don't have to have their data records there. We've given everybody a severe bleeding disorder alert card. So they show that information. If we were to try and link every hospital, we would still be here 15 years later. So at the time, to save time and to improve treatment, we set up so that the hospital used the app. So they scanned it in and out the same way the patient does and sends it over. The hospital rings the main centres, and they work with the health record that they have. And the information just goes round and round. Now, one of the things that we introduced at this point, which I think is exceptionally useful, is a warning system. So the warning system So the warning system basically suggests in a certain event, so if you have a bleed in your head, then you get an instant 24-hour call to the patient. Through all of this, we've purchased the most safest and most efficacious products. We have access to everything that we require in the country. We are the highest user of factor concentrates in Europe, but probably in the world. And we're the first country to improve access to treatment and increase troughs. And all of it, was done by increasing the treatment and reducing the cost. We had the same costs in 2002 in Belgium, or the same system in 2002 in Belgium. They didn't change their system, and on the right-hand side in the yellow is the costs that went up in Belgium, and in the blue on the right-hand side is the costs in Ireland. It came down over time because we knew what we were doing, and we were aiming to improve the patient experience, treatment, and the health system. Thank you very much.